Good morning, dear students. I'm Dr. MITTHRA, reader from the Department of Conservative Dentistry and Endodontics, Sri Balaji Dental College and Hospital. And my presentation today is going to be about zinc phosphate dental cement. So let us go to the in detail about zinc phosphate cement. So I put the picture here where you can see zinc phosphate cement as such is available as powder and as a liquid. So coming to the contents of today's class, so we are going to see a brief introduction, then we are going to see about the definition of dental cements, then we are going to see about the classification of dental cements, we are going to see in detail about the composition of zinc phosphate, in detail about the setting reaction, in detail about the setting time, working time, mixing time, manipulation, the physical properties, the biological properties, the applications and the clinical uses of zinc phosphate cement. We are also going to see about the advantages and disadvantages. Now coming to the definition of dental cements as from Anusava's textbook, it can be defined as a substance that hardens and acts as a base. It can be a liner or a filling material or an adhesive that can bind devices and processes to the tooth structure and to each other. Another definition given from the textbook of dental materials by Craig says that it is a non-metallic material which is mainly used for luting, filling, permanent or as a temporary restoration. It is made by mixing the components into a plastic mass that sets to form an adherent sealer, and it is used in attaching various dental restorations to the tooth structure. This is the definition given by Craig. Okay. Now we'll go into detail about the history. So the oldest dental cement that was used, which has got a very long track record, is nothing but your dental amalgam, introduced in the year 1933. Coming to zinc oxygenol, introduced in the year 1958 coming to the year 1879, here comes your zinc phosphate cement. And silicate cements, it's a tooth colored cement introduced in the year 1908. Calcium hydroxide introduced in the year 1936. Acrylic resin based cements introduced in the year 1947. Reinforced zinc oxygenol introduced in the year 1958. Composite resins introduced in the year 1962 by Dr. Ray L. Bowen. Zinc polycarboxylate also, which has got chemical addition to the tooth structure. Similarly, GAC, which has got chemical addition to the tooth structure, introduced by Wilson and Kent in the year 1969, and zinc polycarboxylate was introduced in the year 1968. Coming to the ideal requirements of any dental cement. So any dental cement, it should be strong, it should be hard, it should be insoluble in saliva, it should be dimensionally stable, it must be adhesive, it must be non-porous, it must be biocompatible in the sense it should not cause any irritation to the tooth structure and to the oral tissues. And the coefficient of thermal expansion and contraction must be similar to that of the tooth structure. It should not be affected by any thermal changes in the oral cavity, and it should be easy to manipulate. Coming to the classification of dental cements, the classification in Anusava's textbook says based upon the setting reaction, it is classified as under acid-base reaction. You have your zinc phosphate, zinc polycarboxylate, zinc oxygenol, and GIC. Under light or chemically activated cements, you have your resin-modified GIC, you have your compomer. Under light activated polymerization, you have your composite resins. Based upon the chemical composition, textbook of dental materials by Craig gives you this classification. So under water-based cements, you have your GIC, resin-modified GIC, zinc polycarboxylate, zinc phosphate. Under resin-based cements, you have your composites and your compomer. And under oil-based cements, you have your zinc oxygenol, and non-eugenol-based cements, you have your cavity varnishes, nothing but your copal resin or rosin, which is dissolved in your organic solvents like acetone, ethanol, or ether. And then you have your cavity liners, mainly your calcium hydroxide, and your high strength bases, which is nothing but your zinc phosphate and zinc polycarboxylate. Now let us go into detail about zinc phosphate cement. So zinc phosphate cement is one of the oldest of the cements. It is available as powder and liquid as two separate bottles. The ADS specification number for general water-based cements is 96, but however the old ADA number for zinc phosphate is number 8. It was introduced by Pierce in the year 1879. It is mainly used for temporary restoration. It is also used as a luting agent. Now let us go into detail about the composition of zinc phosphate. So any dental cement, if you learn it under the following headings, it's useful. So the first column will be the ingredient, next will be the weight percentage, next will be the function. So the main ingredient here, we have the powder and the liquid. So the main ingredient in the powder is nothing but your zinc oxide, which is around 90.2%, which is the main ingredient. Then you have your magnesium oxide, which is around 8.2%, which reduces the temperature of calcination. Then you have your silicon oxide, which is the percentage of 1.4%, which acts as a filler and also aids in calcination. Next is your bismuth trioxide, which is around 0.1%, which gives you a smooth mix and increases the setting time. And then you also have your miscellaneous compounds like barium oxide, barium sulfate, calcium oxide, and that's the same percentage, 0.1%, mainly for pigmentation and radio opacity, so that it is visible as a white image in the X-ray. You can see it in the X-ray. And the liquid is mainly your phosphoric acid, which is a free acid, which is around 38.2%, which reacts with your zinc oxide. The phosphoric acid can also be combined with your aluminum and zinc. That percentage is around 16.2%. This reduces the reactivity of the free acid. Aluminum percentage is about 2.5, which provides neutralization, buffering action, dilution, and it tempers the acid reactivity. Then zinc is about 7.1%, the same function as above, and water, which is about 36%, that controls the ionization of the acid. Now let us see about the classification. So zinc phosphate cement is classified into two types. You have type 1 and type 2. So type 1 is mainly the fine grain type, which is mainly used for luting, that is to lute your bridges, crowns, etc. So the film thickness is about 25 micrometers or less. And type 2 is the restorative consistency, which is medium grain. The film thickness is about 40 micrometers or less. Type 2 restorative zinc phosphate is mainly used as a thermal insulating base underneath your amalgam. It can also be used for cementation of orthodontic bands, and it can also be used for as a temporary or an intermediate restoration. So if you see this picture here, zinc phosphate, when it's used as a thermal insulating base, it mainly gives protection to the pulp from all, it gives all 4 types of protection to the pulp. That is chemical protection in the sense it prevents any toxic substances from amalgam leaching onto the pulp. Thermal protection, when you give your zinc phosphate as a base, it prevents the transfer of hot or cold to the underlying pulpy tissue. And mechanical protection, zinc phosphate, as I already told you, it is a high strength base. So it is able to withstand the heavy condensation forces of amalgam. And never place zinc phosphate in a deep cavity. If it is a deep cavity, you need to place your calcium hydroxide as a cavity liner, which gives you the it stimulates the rapid dentin formation when used in deep cavities. Then only over which you can place your zinc phosphate, followed by the amalgam restoration. Coming to the manufacturer, so if you see zinc phosphate, the ingredients of the powder are heated together at a very high temperature, that is around 1000 to 2300 degrees Celsius for about 4 to 8 hours. The castration results in a fused or a sintered mass. The mass is ground and pulverized to form a very fine powder, and it is passed through a particular sieve to get the desired particle size. The degree of calcination, the fineness of the particle size, and the composition determines the reactivity of the powder with the liquid. The setting reaction, if you see for zinc phosphate, so this is a very important short-term question from the exam point of view. So first, when the powder is mixed with the liquid, the superficial layer of the zinc oxide is dissolved by the acid, and the wetting starts, acid-base reaction starts. So now the zinc ions are released into the liquid. So if you see zinc oxide combined with your phosphoric acid, okay, it gives you a byproduct along with water. Now zinc oxide further combines with this byproduct along with water. It results in the formation of your zinc aluminum phosphide gel, which is a hopeitite crystal structure. So aluminum forms a complex with the phosphoric acid, and ultimately the set product, if you see, it is the structure of the set cement. If you see, it is a core structure. In the center, you have the unreacted zinc oxide powder particles in the center, which is in turn surrounded or embedded in a matrix of your amorphous matrix of your zinc aluminum phosphate gel. So overall, the setting reaction is exothermic in the sense heat is liberated. So that's why while mixing your zinc phosphate, you have to mix it on a glass slab over a wide area, so as to dissipate your heat. This is the opioid crystal structure, which is formed at the end of the setting reaction of your zinc phosphate cement. Coming to the setting time, the mixing time, the working, and how do you actually do the mixing for your zinc phosphate cement. So the mixing time, it is defined as a time from the addition of the powder to the liquid until the mixing is completed. So if you say mixing time, it is around 60 to 90 seconds. So now the working time. Working time is the time available to use a workable mix. It is one that maintains a particular consistency so that you can perform 1 or more tasks. That is, it is measured from the start of mixing to the point where it reaches a consistency where it is no longer available for its particular intended purpose. So the working time for zinc phosphate is around 3 to 6 minutes. Coming to the setting time is a time elapsed from the beginning of mixing until the cement hardens. So it is measured with a 1 millimeter diameter Vicats needle and where a load of around 400 grams is applied and the temperature is around 37 degrees Celsius. So it is measured from the time started from the start of mixing to the point at which the needle no longer makes a circular indentation marks on the surface of the cement. So the setting time for zinc phosphate is approximately 2.5 to 8 minutes. In simple words, setting time is the time started from the start of mixing, is the time elapsed from the start of mixing until the cement hardens. Coming to the factors affecting the setting time for zinc phosphate cement, by reducing the powder liquid ratio, you get a thinner mix. This gives you an increased working time and a setting time. However, the pH of the cement is very low. So the low pH is basically an acidic pH, which can cause damage to the pulp. Hence, this should not be done. Mixing the cement in increments increases the working time, setting time. It also allows more powder to be incorporated into the mix. When you prolong the spatulation of the last increment, matrix that is formed, that is the zinc aluminum phosphate gel matrix that is formed, is fragmented. So when the matrix is fragmented, extra time is taken to rebuild the bulk of the matrix. Thereby, it gives you a longer setting time. The setting reaction is exothermic in the sense heat is liberated during the mixing of the cement. Hence, you have to use a on a glass slab, you have to mix it over a wide area so as to dissipate the heat. But however, you can, since it's an exothermic reaction, you can regulate the temperature of the glass slab. That is, you can use a cool glass slab. Cooling the glass slab can be done by keeping the glass slab in the freezer or in the refrigerator prior to the mixing. Addition of water, this decreases the setting time, and loss of water increases the setting time. The smaller the powder particle size, the greater is the surface area of the powder that is available to be in contact with the liquid. Hence, more rapid is the setting reaction. The setting time can be extended by slaking the liquid. In the sense, small amount of powder is added to the liquid a minute before the main manipulation process of zinc phosphate is started. So coming in detail to the manipulation, how do you mix this zinc phosphate cement? So you can see in this picture, the materials that you need for mixing is a glass slab. Then you need the powder bottle, you need the liquid bottle, and then you also need your cement spatula. Okay? Ideally, a double-ended cement spatula is recommended. Then this particular scoop that is given by the manufacturer himself in order to dispense the powder. So there are two consistencies. Basically, there is a luting consistency and there is a restorative consistency. So the powder liquid ratio is about 1.4 grams of powder is mixed with 0.5 ml of the liquid. So for luting, if you see, the ratio is 1.5:1. For restorative, if you see, the ratio is 2.5:1. So for the luting consistency, you will get a string that is formed after the mixing is completed. When you collect the material onto the spatula, and when you raise it from the glass slab, a string will be formed, and this string will characteristically break when you raise the spatula greater than 1 inch. Okay, so the string-like material will fall down like a hook. Okay, so this indicates that it is the correct consistency for the luting. For restorative consistency, the correct consistency is like a putty-like mass, like a double-like consistency, where you can roll it onto the glass slab, and it will not stick onto the spatula, as well as it won't stick onto the surface of the glass slab. So this indicates the ideal consistency. So how do you do the mixing for luting and for restorative for zinc phosphate? I'll explain now in detail. So first, before dispensing whatever the consistency, luting or restorative. So luting is mainly used to lute your crowns, bridges, FPDs, your inlays, onlays, crowns, whatever it is. And your restorative consistency is mainly used as a thermal insulating base in your underneath your class 1 or your class 2 amalgams. So the first thing is you shake the powder. Okay, you shake the powder and the liquid bottle well before dispensing the desired amount onto the glass slab. So it is very important to shake the powder well. Once you shake the powder well, you have to the temperature of the glass slab should be ideally 18 to 24 degrees Celsius. The temperature should not be below the dew point. So that is most important. Then mixing is done over a large area on the glass slab because it is an exothermic reaction, so that the heat should be effectively dissipated. So ideally, first you dispense the powder. You divide it into 6 or 7 equal increments. That's very important. Dispense the powder, divide it into 6 or 7 equal increments. Then you dispense the liquid. For example, if you're mixing the luting consistency, you have to dispense 2 scoops of powder and approximately 6 to 7 drops of the liquid. So that is for the luting consistency. Supposing you are going to mix the restorative consistency, then you have to dispense 2 scoops of powder and 4 drops of the liquid. So first you dispense the powder, divide it into 6 increments, then you dispense the liquid. Then increment by increment, you have to incorporate into the liquid and mix it in a circular motion on a wide area on the glass slab. So each increment should be mixed for ideally for 10 to 15 seconds so that you achieve a uniform consistency. So, so as I told you, once all the increments are incorporated into the liquid, when you raise it, if it's a luting consistency, when you raise it from the surface of the glass slab, a string will be formed, which will break exactly when you raise it greater than 1 inch. So ideally, the mixing time is around 60 to 90 seconds. Okay. I have a mixing video here wherein I will show you that at the end of the class. Coming to the frozen slab technique. So the frozen slab technique is a method to in order to give you a longer sitting time. Here what you do basically you're regulating the temperature of the glass slab, wherein the glass slab is kept in a refrigerator or a freezer. If it is in the refrigerator, it is 10 degrees Celsius. If it is in the freezer, if it is in the refrigerator, it is 6 degrees Celsius. If it is in the freezer, it is 10 degrees Celsius. So you basically get a cool glass slab. So when you regulate the temperature of the glass slab, you get a longer setting time. Okay, the setting time is extended, and you have more time to work with the cement. However, here no attempt is made to prevent any moisture from condensing onto the glass slab when it is brought to the room conditions. As I told you, 75% more powder is allowed to be incorporated into the liquid, wherein the strength properties is not affected. The tensile strength and the compressive strength of the cement is definitely not affected. And it, however, you have a higher powder liquid ratio. So the main advantage of the cool glass slab technique is that it gives you an extended working time, which is around 4 times more than the normal working time. And however, you have a slightly shorter setting time of the mix. So this is the cool glass slab. So the glass slab is cooled in a freezer or in a refrigerator. First dispense the powder, then dispense the liquid, and you divide the powder into 6 or 7 equal increments. The spatula must be held flat on the surface of the glass slab while mixing, and each increment is mixed as usual in a circular motion in a wide area on the glass slab. So whatever the consistency, luting or restorative, the mixing is completed. So coming to the properties of zinc phosphate. So first is the compressive strength. As I told you, zinc phosphate is one of the strongest of the cements. So it's got a very, very high compressive strength. So the compressive strength for luting is at about 104 megapascals. For restorative, it is about 119.3 megapascals. The tensile strength for zinc phosphate is about 5.5 megapascals. The cement is, however, the tensile strength is relatively low when compared to that of the compressive strength. Any loss or gain in water will affect the compressive strength as well as the tensile strength. Because of its high compressive strength only, your zinc phosphate is most commonly used as a thermal insulating base underneath your amalgam so that it can withstand the heavy condensation forces exerted by amalgam. Coming to the dimensional stability, So the initially there is a slight expansion because of absorption of water from the oral cavity. So this expansion is followed by a slight, a very less shrinkage, which is about 0.04 to 0.06% in 7 days. The thermal and electrical conductivity, as I told you, zinc phosphate acts as a thermal insulating base. It gives you very good thermal and electrical protection to the pulp. That is, in the sense, it prevents any heat or cold from the restoration from being transmitted to the pulp, and it also gives protection against galvanic shock, wherein two dissimilar metals rub against each other, and one acts as the anode and the other acts as a cathode, and saliva acts as the electrolyte, wherein the current is completed, okay, and it results in a severe shock-like pain. So that is prevented by when you use your zinc phosphate as a thermal insulating base. So in the value for the electrical and thermal conductivity in a dry state is about 3.11. In the wet state, it is about 3.88. Coming to the solubility and disintegration, for any dental cement, ideally the maximum solubility should not exceed 0.3%. So, however, zinc phosphate should not be placed on the cable surface margins, because once it is exposed to saliva or oral fluids, it will dissolve. It will undergo dissolution. And if this happens, there will be a micro leakage or a marginal gap that is created between the cavity wall and the restoration, which in turn can lead to micro leakage, bacterial penetration, and ultimately failure of the restoration. So zinc phosphate should always be placed only on the pulpy floor, that is on the floor of the cavity. Never place zinc phosphate on the walls. So after setting, the first 24 hours, it has got a very high solubility in water, which is about 0.04 to 3.3%. However, when it comes in contact with saliva, the cement is not properly set. Supposing it comes in contact with saliva, there is leaching of the free unreacted phosphoric acid, and this in turn, if there is leaching of free unreacted phosphoric acid, this can result in a low pH, which in turn can have a detrimental effect on the pulp. However, when there is a high powder liquid ratio, when you do proper isolation while placement of the cement, okay, this reduces the solubility of the cement. So the low solubility of the cement is ideally preferred. However, the cement has low solubility in water when compared to the other cements, like for example your zinc oxide eugenol. However, zinc phosphate has got a greater solubility in lactic acid, acetic acid, and citric acid. The value for the elastic modulus for zinc phosphate is about 13.7 gigapascals. This is similar to the dentin. Hence, the material is stiff. It is resistant to elastic deformation. So, it is mainly used as a luting agent for restorations, which are going to be subjected to heavy masticatory stresses. So, Harvard cement is the other name for your zinc phosphate. So, what you can see here is FPD, which is being luted with your zinc phosphate cement. So this table is to summarize the properties. When you decrease the powder liquid ratio, the compressive strength, the film thickness is decreased, the solubility, the acidity is increased, the setting time is slowed down. When you increase the rate of the powder being incorporated into the liquid, the compressive strength is decreased, the film thickness and the solubility and the acidity is increased, the setting time is also faster. When you increase the temperature while mixing the material, the compressive strength is decreased. However, the film thickness, the solubility, and the acidity of the cement is increased. You have a faster setting time. Supposing there is water contamination, the compressive strength is reduced. The film thickness, the solubility, the acidity is increased. Here also you have a faster setting time. So this table is to summarize the values which you need to know for zinc phosphate. For the value for the compressive strength, for luting, it is about 104 megapascals. For restorative, it is about 119.3 megapascals. The value for the thermal conductivity is about 3.11 to 3.88 Kelvin, degree Kelvin. For tensile strength, the value is 5.5 megapascals. For elastic modulus, the value is 13.3 gigapascals. The solubility in water at 24 hours is about 0.04 to 3.3%. Ideally, at the end of 48 hours, the solubility is further reduced. So how the cement is retained onto the tooth structure? The cement does not have any chemical addition to the tooth structure. It is only by retention, by locking into the micromechanical irregularities that are created onto the tooth structure. So the setting of the cement does not involve any interaction with the surrounding tissues. So it is only by mechanical interlocking into the interfaces. So coming to the biological properties of zinc phosphate. So this by itself is a shorthand question for you. So immediately after mixing the cement, the pH it has got a low pH in the sense it is highly acidic. So 2 minutes after mixing, the pH is 2. So this can damage to the pulp. This can cause damage to the pulp if your zinc phosphate is placed in deep cavities. So never place zinc phosphate in deep cavities. Always you have to protect the pulp by liner, a cavity liner like calcium hydroxide as a cavity liner, or MTA, that is mineral trioxide aggregate, as a cavity liner, then over which you can place your zinc phosphate cement. So, however, this pH increases to about 5.5 at the end of 24 hours, and then it slowly reaches neutral pH at the end of 48 hours. So, initially damage to the pulp can occur if the freshly mixed cement is placed in direct contact with the pulp. So it increases because of the high acidity of the cement, that is a low pH, high acidity of the cement, can lead to an inflammatory pulpal response, ultimately irreversible pulpitis and pulpal necrosis over a period of time. So remember, thin mix, low pH, okay, it takes a longer time to achieve the value of the neutral pH. Hence, you should mix the cement properly. And please remember, never place zinc phosphate in deep cavities. So ideally, if it is a very deep cavity, then definitely you have to use your cavity varnish or your calcium hydroxide or MTA as a cavity liner, over which only you can place your zinc phosphate. So this is a table in Anu service which gives you the time and the pH value. So 2 minutes after mixing, the pH is 2. After 5 minutes, it increases to 2.55. At 10 minutes, it increases to 3.14. At 15 minutes, it increases to 3.3. At 20 minutes, it comes to 3.6. At 30 minutes, it is 3.7. At 60 minutes, it is about 4.3. At 40 minutes, it reaches around 5.5, and at the end of 48 hours, it reaches the neutral pH. So coming to the clinical applications and the uses of zinc phosphate cement. So as I told you, we have two consistencies, isn't it? There's a luting consistency and it is a restorative consistency. So the luting is mainly used to lute your inlays, onlays, your crowns, even your cast post and core. Okay, it can also use to lute your orthodontic band. So you can see here this is a molar band. Okay, wherein your bracket is placed. Okay, this is your inlay, onlay, and this is your crowns. Okay, so however, the main use of your zinc phosphate restorative is a thermal insulating base. Okay, so you can place your zinc phosphate as a high strength base over which you can condense your amalgam restoration. It can also be used as a temporary or a provisional restoration or as an intermediate restoration. And the luting consistency of your zinc phosphate is used for cementation of your orthodontic bands. So what are the advantages of zinc phosphate? It is easy to mix. It has got a sharp and well-defined set. It has got a high compressive strength. Hence, it is able to resist the condensation forces of amalgam. It has got a low cost. The disadvantage is that it is initially after mixing, the pH at 2 minutes after mixing, the pH is 2, which is a highly acidic pH. It can cause damage to the pulp if the freshly mixed cement is placed directly in contact with the pulp. It does not have any antibacterial action. It is brittle. It does not adhere to the tooth structure like your GAC or like your composite resin with the help of bonding agent is bonded to the tooth structure. So here zinc phosphate does not have chemical adhesion to the tooth structure, and it is relatively soluble in the oral environment. Yes, when it comes in contact with saliva, it will undergo dissolution. So some modifications of zinc phosphate have been done in recent times so as to improve the properties of zinc phosphate cement. Fluorides have been added, like fluorides like stannous fluoride, etc. have been added at a concentration of about 10%. So fluoride gives you a longer time. Okay, over a period of time, fluoride continues to be released, and it makes the fluoride available for the enamel to absorb, and it thereby increases the hardness of the enamel. And however, there is low strength of this material. Coming to copper-based zinc phosphate cement, so here the copper-based cements added are mainly your cuprous oxide, which is red in color, cupric oxide, which is black in color, cuprous iodide white, then copper silicious oxide, which is in green, and silver salts. So when copper is added to zinc phosphate powder, it is the main advantage is germicidal. It has got a bacteriostatic action in the sense it prevents the multiplication of the bacteria. However, the longevity of this antibacterial action is questionable. So the two modifications basically in zinc phosphate cement, remember, fluoride is being added to the powder and copper is being added to the powder. So fluoride is added to the powder, it's going to have an anti-carcinogenic effect. It prevents the occurrence of dental caries. It prevents um, uh, a secondary caries beneath the restoration. That is the main use of adding fluoride. And when copper is added, it has got antibacterial action, mainly bacteriostatic action. However, the longevity of this action is questionable. So that's it for today's class. I hope you understood everything well. Thank you for your listening. Thank you for your patient hearing. Thank you.